Burundi and South Sudan have so far registered the lowest number of patients testing positive for COVID-19.
We understand that now Burundi have 5 cases of coronavirus and 1 fatality, which happened earlier this week. The government has tried to take some precautionary measures in order to contain the spread of the virus in the country, whereby now, for example, they have banned hugging and kissing, which has been a tradition to Burundians, and hugging and kissing, this is their traditional way of greeting, and also putting water points in every single building in town, in churches, in institutions, everywhere where people can wash their hands.
That makes South Sudan remaining with 4 confirmed cases for the 5th day in a row.
Burundi, Tanzania and South Sudan have had a liberal approach to preventing the spread of the disease compared to Uganda, Rwanda and Kenya, who have had a partial or full lockdown.
Lockdown, like banning public gatherings, which is still ongoing here in Burundi. And you remember that recently that we have been celebrating Easter. The churches were open, people went to the mass and attended the mass, but though there was social distancing.
However, Kenya, Rwanda and Tanzania have the highest number of people testing positive with COVID-19. Kenya has the highest at 247, followed by Tanzania with 147 from 94, and Rwanda at 138.
Basically, our policy of dealing with corona is that we are not going to go on a total lockdown, but we are discouraging travels, unnecessary travels, unnecessary moving out. We are remaining open, but with limitations. And we have to observe the guidelines that have been given by the Ministry of Health.
Just like if you look at the numbers which are rising now, and if you try to track on the record on what Tanzania is suffering from, most of the people who came into Tanzania right now, they were also, they are still possessing people who are imported. They are all arrivals.
The regional leaders are set to meet and discuss modalities on how they can fight COVID-19 pandemic as a region.
For the presidents right now, they are going to have their summit for health, and particularly the topic is coronavirus. And they are coming up with the directives on alternatives on how we can control and fight the spread of the disease within East Africa. Yeah, the summit would have been on 16th of April. There was a request by one partner state to have it extended, and we anticipate by 23rd, probably they will be sitting.
This time round, the heads of state will deliberate by video conferencing. This method of holding regional meetings by video conferencing, according to Maganda, is expected to bring down the cost.
It is a venture that costs not less than 2 billion shillings, Uganda money, to organize one summit, because it has many people who are supposed to attend the summit, but also at the same time there's a lot of travel involved and a lot of hiring of space and conference centers.
As a region of East Africa, Uganda has received mobile laboratory vans that will be used in testing COVID-19.
Uganda got 2 mobile laboratories, Kenya 2, and Tanzania also 2. And then the other 3 countries got 1, because their size of population is also small.
JJINGO FRANCIS, NTV.